Welcome everybody to the channel. If you're new, you're welcome. Today's a bit different than my usual thing for about TV licensing. Obviously today I'm going to a hospital today to check whether I still have cancer in my body. Basically I have to have a operation, keyhole surgery basically. Just to go into my bladder area. Not looking forward to it, a bit apprehensive about it, whether they'll know when they go in and they'll look around whether the treatment I've been having the last 6 months anyway before Christmas has worked. So it's a bit of anxiety moment for me. I still have to have further treatment anyway, but it's whether when you have a tumour removed from your body, you're always worried about whether it's going to come back, especially with the cancer I have had. It's quite an aggressive one. So anyway, I'm off to a hospital now to see the surgeons and do all the work. It's a standard procedure, but as I said, we'll see what happens when I get out, and I'll do another part of the video. This is before I go in, of course, so hopefully I'll have some good news for you. Everything is okay, and I'm not going to have to have any another operation to remove a tumour if it's still growing back. That's you're going backwards then if that happens, you know, because it's still growing, and then it's just more operations and stuff like this. So fingers crossed everything's going to be okay, because you know, it's a terrible thing to have to go through. So I'm sharing it with everybody. But I got lucky. I got caught early. It's not got into my inner wall of my bladder. So all being well, it's the job. The treatment's worked. But anyway, I won't know till I've had the operation. Well, the operation, and you know, we'll see what happens. Anyway, folks, I'll see what happens when I come out of the hospital. Well, folks, 2 hours later after my appointment, I had to wait about 2 hours to my 1 o'clock appointment. It's now just nearly 3 o'clock when I'm doing this. They were very busy in the ward I was in, and as I said, you have to just understand these doctors are very busy and stuff, and the anxiety was, but you know, tremendous, just hanging about. And then he sort of took me in for observation. My blood pressure was very high, and stuff like that, you know, so they was concerned about my blood pressure more than anything else. Anyway, I calmed down with a cup of coffee and stuff, you know, because it was a busy day, put it that way. And I had to go into the to see the surgeon, and anyway, the good news is, of course, cancer is not growing back in my tumour's not growing back in my body, in my bladder. The doctors are very, very happy that there's no reoccurrence of anything at all to be worried about. And I was quite reassuring when he told me that, and they're quite happy with everything. However, I've still got to carry on with the treatment in about 5 weeks' time. He said, "You give yourself 5 weeks, probably March, something like that, maybe a month, something like that, when I start the treatment, because it's what they call a maintenance treatment, basically, because once you've had cancer, and it's quite a aggressive cancer in the bladder area, you know, there's always that possibility it could start growing back and stuff like this over the first 2 years anyway. It's a bit like breast cancer with women. They have to have a couple of 2 or 3 years checkups, because it can come back, and it's one of them things that they just don't know. So they have checkups regular, and of course this maintenance drug I'm on, with more drugs in myself, you know, doing the drug once a month on a Wednesday, well, sorry, once a week for 3 weeks. I've only got 3 weeks treatment. They've halved the treatment, which is what they do when you get to this stage after a year. It's almost a year to this month really when I started the treatment. Yeah, so it's cancer-free for over a year now, which is good, our doctor says. So, you know, if it was going to come back, it would have come back, put it that way. That's what he was happy about. They're happy that it's not reoccurred, and the treatment's working. So I've got another year of this treatment. Every 3 months I've got to, you know, have this checkup basically, and the treatment for 3 or 4 weeks, 3 weeks treatment, and you know, they're happy that it should be okay. And another year, and they'll make an assessment after that year whether I need that 3rd year, because that's, you know, probably a possibility I don't need. But anyway, that's the good news anyway, so I'm happy about that. Like I said, you know, you feel better when the doctor says you're cancer free, and it's not going back in you, because like I say, it's not like having a cold or flu. It's something that's growing, and cancer does grow and come back. And of course, if you catch it early, which they did with me, very luckily they caught it early, and it didn't go any further, and just in a wall. They removed the tumour before it could spread in other parts of my body. So I was really, really lucky. And of course, as I got high blood pressure, the doctor was saying to me, they're more concerned about my blood pressure being very high. But maybe because I was nervous, I don't know. You know, whatever, they're more concerned about that because it's very high. I nearly blew up the machine. Well, as I said, all being well, they're happy that everything's fine, and reassure myself, which is, you feel a bit better. It's just a maintenance treatment now for the next year. Then they'll make an assessment about the 3rd year, because it's just treatment, you know. But I'm lucky, like Prince Charles, of course. Prince Charles had he's Prince Charles. Yes, Prince Charles. He's had his you know, because he's got cancer like myself. He's got cancer, Prince Charles. So you share cancer with everybody, you know, Prince royalty and everything. But Charles has had his treatment, you know, reduced kind of thing, you know, as he says. So yeah, the treatment gets reduced when it's working, obviously. You know, it is working, the treatment, which they're happy with. So me and Charles are the same situation, basically. Anyway, that's a good news, which I wanted to pass on to other people on the channel, because this is part of my ongoing treatment. And anybody else who's got diagnosed with it, it was quite a bit of, it wasn't too painful, it wasn't bad, you know. I mean, it was annoying really, more than a bit of pain, but nothing to worry about. It was just irritation really. When they did the keyhole surgery kind of thing, you know, when they went and had a look, unnerving really, you know, really. And but they gave me an injection to kill the pain and stuff, so it wasn't too bad. I'm just coming out of it now, basically. I'm feeling okay. But the glad news is, obviously, I'm cancer free, like Prince Charles, you know, like my friend Charles. Yeah, at least we share that together. He's rich and I'm poor, you know. But anyway, folks, there's nothing more I can say really. I look forward to the next round of treatment, because I say it starts in March. So I've got a bit of a break because things have to recover a bit in that area, and then I start the treatment. You know, which is part of the ongoing thing, maintenance kind of thing. Anyway, folks, hope it's been useful for somebody who's going through bladder cancer like I've been gone through over 12 months now. And the treatment does work, and you know, so hopefully everything will be fine now, and I can, you know, move on from it and not be as worried as I used to be, because if it's not growing, that's the main thing. You know, it's not coming back, hopefully. But like I say, time will tell, and cancer is a thing that, you know, you got to have the right diet as well. I'm having a special diet as well, and that's you know, that's another thing I've got to look into and stuff. But anyway, thanks again. Leave your comments below if it's been helpful for you, and a thumbs up on the video. And of course, I'll be sort of doing the next one about it in March, when I have to go to the this place, Macmillan Centre, to have some treatment. It's not chemo treatment. It's a different kind of thing. It's just a drug they put inside me for about a couple of hours, and I have to get rid of it. You know, it's a different kind of treatment. It's not chemo or anything like that. Anyway, folks, thanks again. Thumbs up, and I will leave some comments, and I will see you on the next one. Bye for now. Bye.